Hey everyone, welcome back to the channel. So today what we're going to talk about is we're going to discuss thoracic outlet syndrome. Now it's an interesting topic of conversation because there's a lot of people out there that have thoracic outlet syndrome. So what we're going to go through today is we're going to talk about just quickly what it is, and then obviously we're going to touch on probably two really important things that you need to focus on in order to try and regain control of your symptoms. And then we're going to frame that in the context of, well, we're treating the symptoms, but how do we stop those symptoms from coming back? We want to make sure that we're talking about ways, or at least touching on sort of the underlying cause of thoracic outlet syndrome, so that you know that when your symptoms are gone and you feel better again, that as long as you're, I guess, thinking about it a certain way, that there'll be little chance of it coming back again. So what we're going to get to start with, so we want to talk about what is it. Now, for people that have it will know exactly what it is. If you're not sure what it is and you're using this video to hopefully tell you a little bit more about it, basically we have the collarbone at the front, and we have your thoracic spine, which everyone tends to know about, with the rib cage over the top of that. So a lot of people don't realize that your first rib, so the top of your rib cage, actually comes above your collarbone at the base of your neck here. And what the thoracic outlet is there's a bunch of nerves, a bunch of arteries and veins and other vessels that sort of come out from the top of your upper back, the base of your neck, and go behind your collarbone or underneath your collarbone and into your armpit, and then supply a lot of the health and function of your arm. So a lot of people that have thoracic outlet syndrome tend to have some type of pain potentially in their arm, potentially their hand. It might be numb, they might have tingles, pins and needles, a lot of those neural symptoms that are coming from sort of the base of the neck and the top of that upper back. Now, one of the things that I think is really important here, and this might be semantics, but it's just an interesting topic of conversation to touch on before we get into it. We often associate thoracic outlet syndrome with what we call an elevated first rib. So we say that the first rib at the back here has been elevated, which is what's sort of compressing those tissues and those vessels as they go underneath the collarbone and down into the arm. And hopefully, with what we'll get to in a second, so later in the video, we'll talk about one of the reasons why this tends to happen, which also ties in with one of the things that you need to do to conquer your symptoms. You might find that that idea of that elevated first rib may not necessarily be correct, or at least it may not necessarily be elevated in the way that we think about it. It might actually be depressed, which is something a little bit different to what's out there at the moment, but hopefully it'll make more sense in a second when we get to one of the causes of thoracic outlet syndrome. So basically what I would urge most people to do, and we've been through this before, so if you've been watching these videos, if you're following the channel, you will recognize this. We use this a lot because it's such a versatile and really, really accurate way to clear up a lot of spinal dysfunction. And one of the key components to improving your thoracic outlet symptoms is improving the mobility of the base of your neck, the mobility of your upper back, and the mobility of your upper rib cage, where that first rib is, and also the tissue below that and above that. It can also help to free up the tissue at the front through your chest and through your shoulder. But for the purposes of this video, we want to go looking at the base of your neck, the top of your upper back, and then move out towards, I guess, to where your shoulder blade would be, and free up the rib cage. And again, if you come in for physical therapy, obviously we can use our hands, we can massage muscles, we can get our thumbs into the joints and mobilize those joints. But if you're at home, a really great substitute is using a ball. So again, this is a lacrosse ball. You can use a tennis ball, baseball, cricket ball, depending on what you feel comfortable with. But the idea is you want to go looking for areas that feel stiff and tight. Now, the key difference for a lot of exercises and a lot of symptoms is that most people are enamored and seduced by pain, which is obviously important. It's a really crucial and critical symptom to be aware of and conquer. But when we're trying to undo the things that have caused pain, we actually want to prioritize stiffness and tightness over pain and tenderness. Now, the reason why I say that is if you're placing the ball in your upper back, say if you start in the middle of your back and just roll out to the side a little bit so you're on the upper thoracic joints, we're looking for joints that feel really stiff and really tight. They may or may not be tender. So if you place the ball here and it feels really sore and uncomfortable, but you move the ball across to the exact spot on the other side and it feels stiffer and tighter, then you actually need to spend more time on the stiffer and tighter side, because mechanically your body doesn't care as much about left and rights as we do as intellectual humans. So if you were really stiff on, say, this side of your spine, it tends to pull slack from everywhere around it, which includes the opposite side, includes the tissue above, below, and on the same side. So if it's really sore here, it just means that this dysfunction has caused some pain to occur in the tissues on this side because there's dysfunctional tissue or dysfunctional mechanics that connect to it or that influence it, for want of a better word. So we need to make sure we take away that stiffness in order for this to have a chance to settle down and feel better again. So it's the same concept with the ball. And what we want to do here, and again, we've done this a lot before, we want to get the ball, we want to place it into your upper back to begin with, right in the middle where the bumps are. We want to let the ball roll off a little bit. Again, we don't want to go too far out towards the shoulder blade yet because that's the rib cage. We want to stay pretty much right up against the side of the spine. And all we want to get you to do is lie down on the ball. So you can do this, again, leaning up against a wall. You do it standing or sitting, depending on what you want to do. But for the purposes of this, we want to get the ball in the back there. And again, as you've seen before here, we want to get you to raise your arm up as high as you feel comfortable. So normal range of motion dictates you should be able to have your elbow straight and your arm should touch the ground. But a lot of people who are really stiff here, particularly when we come up higher to that first rib, you might find that you can only get to here before it feels stiff and tight. But what we want to get you to do is just keeping your arm straight, just use your motion to oscillate in and out of that position, and you'll find that very quickly that arm will go further and further and further. And that's the heart of the exercise. So from here, we want to move the ball up a little bit higher towards that first rib, but still next to the spine. Just keep repeating that process, and we'll come up right to the base of the neck. So we're not rolling up and down on the ball. We're placing the ball in a position, using movement to shear that tissue free. We're using the pressure of my body weight and gravity to get the joints in the spine to give and start to move. And using the arm over the top sort of influences that to happen further. So we don't want to miss anything. So if you're starting sort of mid-shoulder blade, you just want to systematically work your way up to the base of the neck. Once you've done that, we then want to come out towards the shoulder blade onto the ribs. Now this is where the first rib tends to be, sort of right at the base of that neck, above the level of the collarbone. You'll find it'll be pretty tender for a lot of people. And again, we want to do the same thing. We want to come up. So for me right now, that first rib's a little bit stiff, so I can get to here comfortably. But what you should hopefully see is as I do this, it just starts to give and give and give and moves a little bit further. If you need some extra pressure, you can lift your bottom up a little bit, and that feels a little bit more tender for me. But again, it allows me to get some more movement through that joint. Now, the important thing, as I said, is for me, that side felt where the stiffness and tightness was. So if I had my thoracic outlet symptoms down that side, I'm trying to feed as much slack up underneath that as possible. But again, if it was really stiff on this side and my symptoms are on this side, I still need to work on the side of the stiffness and free that section up to feed slack into it from the other side. So I guess we don't want to necessarily go into this with a preconceived idea of where your stiffness is. You want to use the ball to go hunting for that. And again, it can be below the level, it can be above the level, it can be on the level, it can also be on the opposite side. So it all feeds into the mechanics of a good healthy area. So we want to clear that up with the ball. So that's sort of the first part of it. The second part is we want to do the same thing, but with the ball up into the neck. So from the bottom half of the neck, again, starting in the middle, just letting the ball roll off to the side a little bit, just like we did in the thoracic spine. We want to get the ball just to lean into that position. And it's a little bit less connected to your shoulder here. So if I'm sort of almost at the base of my neck here, I've got to turn my head a little bit to that side just to let the ball rest on that bony shelf. And it doesn't necessarily work for me to use this, to use my arm, sorry. So what we want to do here is we just want to find a spot that feels stiff. We just want to let the ball rest in there. So again, if you've got something to watch on TV, if you've got a phone to use, just accumulate 2 minutes, 3 minutes, 10 minutes, whatever you need to do to find that stiffness and let the ball press in to release that stiffness. Once you feel like you've done something, then just move the ball down a fraction further again, go hunting for the spot that feels stiff, again, let the ball press in, and then hopefully you'll start to feel all that tissue free up. Now, the other important consideration to be aware of is at some point you may hit a spot that generates some of your symptoms. If that area is stiff, as I said before, then definitely respect how that feels, but you'll hopefully find that as that tissue gives and frees up, you might find those symptoms start to reduce. Again, if you put pressure on a spot that doesn't feel stiff, but it flares up your symptoms, but you come across to the other side and it feels stiff, then obviously that's the side you need to work on to allow that whole section to free up and give. Now, we want to make sure that you become very acutely aware of what section or what specific area of your neck and upper back connects with your symptoms. We know that thoracic outlet tends to be some dysfunction with the gap between the collarbone and the rib cage, the front of that rib cage. But you might find that if you come more central towards the back there is a part of that mechanism that is more commonly linked to your symptoms, and you can find that with the ball. So as we always say with that exercise and any exercise, take note of how your symptoms feel to begin with. Work really hard on mobilizing that tissue so that you feel genuinely looser for having done that. Hopefully having found a spot that connects up to those symptoms, then once you've finished your self-treatment for the day or for that period of time, reassess your symptoms again. Because if you've done something, if you've done anything important, you should see a subtle change at least in your symptoms. So if you've hit the right spot, it's freed up enough. If that's connecting to your symptoms, you deserve to see a change in some way. And if you haven't seen a change or you don't see a change, you probably haven't made a change, and you've got to keep hunting for those areas. Or again, have a therapist look at it, allow them to give you some guidance so you know where to work hard going forwards. So from an exercise perspective, it's a really powerful exercise to feed some slack into that area, take all the pressure off the tissue that are struggling and causing those symptoms into your arm. So that's the first thing. The second thing, which is potentially the most important thing about thoracic outlet syndrome, touched on it at the start of the video in terms of that elevated first rib and whether that's anatomically what's going on. It may be, but it may not be at the same time. We want to talk about what's potentially causing thoracic outlet syndrome, because it ties heavily into making sure that those symptoms go away. Because if you're working hard and you're getting treatment from a good therapist and you're self-treating yourself, and you are still doing this thing that we're about to talk about, then you're essentially sort of pushing back against all the hard work that you're doing. And if you're trying to dig yourself out of the hole, essentially as you're digging yourself out, it's backfilling behind you. You're not necessarily making those gains long term. And it can be quite frustrating for people that have thoracic outlet syndrome because it sucks. It's not a very fun thing to have. So I guess the second thing, and as I said, is potentially one of the most important things. It won't surprise you once we start talking about it. And again, it's not sexy, it's not interesting, it's not a priority for a lot of people, even though intellectually we understand its importance. But the reality of what we put into practice doesn't always measure up to that. And the thing I'm talking about is posture. So the positions that you put your neck, upper back, and shoulder in are acutely connected to the onset of thoracic outlet syndrome in terms of what we see clinically. And what we find is, so if this is the side for me that has that, the reason why this is because if you can imagine all the tissue coming from this part of your neck and upper back, going sort of behind your collarbone in front of your rib cage and down into your arm, everything functions really well in this position. If we all of a sudden get into a position, whether this is your mouse hand, where that shoulder drops and rolls forwards, so we're consistently hanging off that tissue when we're in this position. And what we see a lot with people with thoracic outlet syndrome clinically is that whether they're aware of it or not, they're often in these positions for a long period of time. Either they're just sitting down in a position like this and those tissues are constantly under tension, the nerves are under traction, that space is just consistently getting closed down by being in a bad position. So again, if you can imagine there's a nice space here, my collarbone's here, as the shoulder drops forwards, it tends to compress and irritate those tissues. So again, if that's your mouse hand, if that's how you drive, if you're doing some arts and crafts, even if you're sitting down watching TV in this position, that position is one of the main reasons why the sections of your neck, upper back, and rib cage that you'll find are stiff with the ball are most likely going to be the same areas that you're constantly creating tension through, most likely without realizing it. So the reason why this is so important is that if you're working really hard on and freeing up all those tissues, again, getting yourself stronger with some strength exercises, if you're then consistently putting that shoulder back into a less than perfect shape, it's very hard for those tissues to stay good. Then they're going to consistently be asked to stiffen and tighten and stay dysfunctional until we can get you thinking about gently pulling your shoulder back and up a little bit. So one of the issues that I have with, I guess, the general perception of good posture, for some reason we talk about good posture as back and down. That's the position that we're often sort of promoting as a good posture. But for some reason we think that people walk around with their shoulders up high all the time. It takes a lot more effort to be into this position than it does in this sort of dropped and rolled forward position. The reason being is that gravity just, when we're trying to relax, which is, I guess, the feature is the catalyst for less than perfect posture, we tend to drop and those shoulders tend to roll forwards just with gravity and the way that our anatomy is structured, it tends to roll those tissues forward. So again, when we're talking about an elevated first rib as being a common association with thoracic outlet syndrome, it may not necessarily be elevated, because that would, I guess, we would assume that that comes from the shoulder being elevated. In reality, the shoulder girdle itself is often depressed and rolled forward. So it may look elevated in relation to the rest of the tissue, but the position that we're in that often causes that is depressed, sort of anteriorly translated position, which creates all that overloaded tissue. So again, the secret is to pull those shoulders back. You don't want to hold your shoulders up, but you want to take your shoulders back and just support the weight of them from a good position. Because from this position, all those tissues are loaded normally. They're not being asked to stiffen and tighten. If you held this position for a long time, your body would sense that as a test to get stronger, because you're not overloading the tissue at the same time. So I just wanted to make that really clear, where if you have thoracic outlet syndrome and you aren't being obsessive about the positions and the postures that side or those shoulders get into, it's very hard to make constant progress over time, because you're consistently asking those tissues to stay dysfunctional. And if you're someone who is looking towards surgery, if you're someone who gets injections or other things like that, then potentially, if you're not working on these things, you're missing the low-hanging fruit, the basic basis of thoracic outlet syndrome. So hopefully that makes sense. So just to recap quickly, if you're not putting it in a good position, all those tissues are being asked to stay dysfunctional. So shoulders back and sort of up a little bit, but not too high. And we want to make sure that we're addressing a lot of that accumulated stiffness and tightness from being in that position. Now, there's obviously a lot of other exercises that you can do in terms of stretching your chest muscles, freeing up a lot of the tissue around that, including the muscular tissue. But good posture and joint de-stiffening are two really crucial things that I see clinically that tend to have a really strong and fast-acting impact on your thoracic outlet symptoms. So hopefully that's really useful information for you guys. If you found it useful, please let us know in the comments below, and also leave a like just so that we can tell that this is useful for you. Again, let me know in the comments how you're going. If you need some specific information, please let me know. I will answer them. I will sort of communicate back. And if you like the kind of content that we're putting out and you find this information useful, it would really appreciate you guys if you consider subscribing as well. It just helps these videos reach more people. And obviously that's the goal. We want people to sort of have a better understanding of why their symptoms are there and how to treat their symptoms, ultimately, so you don't have to put up with these frustrating conditions. So if you could do that, that would be fantastic. So that's about all for me. So if you have any questions, let me know. But until next time, I'll see you soon.